Talking with us right now is Dr. Jeff Keller. He is the director of the Institute for Dementia Research and Prevention. And Dr. Keller, thanks for being with us this morning.
Yeah, thank you guys for having me on this rainy day to talk about what hopefully is a real promising start here for Alzheimer's prevention.
What are you looking for? I take it, I'm trying to read through the science here, that this is an investigational study, that you're trying to find some specific things?
Yes, sir. So the cases of Alzheimer's disease are expected to triple from 5 million today to 15 million in the next 35 years. And, of course, with Alzheimer's already being the most costly disease in the United States, we just can't afford to let that happen. So at our institute at Pennington Biomedical, where we look for the triggers and treatments for chronic diseases throughout the lifespan, we have a nice complement now of Alzheimer's prevention studies, the largest number from Houston to Birmingham. And folks from East Texas to Pensacola take advantage of this. And so we would hope to educate people about what's right here in their backyard. And essentially what we have are 3 Alzheimer's prevention studies that focus on, we're looking for a variety of people, basically people 60 to 85 who are concerned about their memory, but don't show any signs of Alzheimer's disease. And they can get into the latest research going on designed to prevent it, either through regulating blood pressure medications, exercise, or anti-amyloid therapy.
Okay, you're going to have to help us out with anti-amyloid therapy.
Yeah, Alzheimer's disease is believed to be caused by, and a lot of evidence supports this, that it's caused by something called beta amyloid. And we have some several studies that use basically a passive immunization approach, which shouldn't scare anybody. It's a way of targeting your innate immune system to removing the beta amyloid that's in your brain. And this is a very promising looking therapy, as is the blood pressure study that we have, where we know that blood pressure, hypertension increases risk for Alzheimer's disease. And we have a study that's specifically designed to, for the first time, understand how tight regulation of blood pressure reduces the risk for developing Alzheimer's disease. And we'll do this study in conjunction with your physicians, and it's a real exciting study funded by the NIH.
We're having a discussion with Dr. Jeff Keller. He is the director of the Institute for Dementia Research and Prevention. The Pennington Biomedical Research Study is marking Alzheimer's Awareness Month with a new Alzheimer's prevention study, ways that you can reduce the risk of Alzheimer's. Dr. Keller, thanks for staying with us.
Yeah, thank you for having me back for the second segment.
Dr. Keller, the physicians and researchers from a large number of disciplines are saying there's a relationship here between high cholesterol and high blood pressure, not just heart disease, stroke, dementia, gastric disease, even pancreatic cancer. Is this research going to take you down a path where you may or may not see some of that as well?
That's correct. About 40% of the people out there age 60 and over have high blood pressure, high cholesterol, and we know that from association studies that there is a link, an association between high blood pressure, high cholesterol, and the development of dementia. And we just were lucky enough to receive a $10 million award from the NIH to do a definitive study to understand if we take well-characterized people aged 60 to 85 and work with their physicians to regulate their blood pressure and cholesterol levels to determine the impact of that directly on dementia risk as well as cognitive change. And so just like you're talking about those studies that have linked heart health to a variety of other diseases, this is going to be the first study to link that cholesterol and blood pressure regulation to dementia.
How many study patients or subjects are you hoping to have for this thing? And is it too late for someone to get in on this if they'd like to?
No, sir. No, sir. We just started recruitment a couple of weeks ago, and this is a study that's going to be ongoing for a couple of more years in terms of recruitment. We need people age 60 to 85 to give us a ring at 225-763-2973 or to email us at dementia@pbrc.edu. You can go to the Pennington website, look at clinical trials, and see not only this study but our other studies focused on dementia prevention. And what I want your audience to know is that, if they don't happen to qualify for this study, we do have other studies that are focused on dementia prevention that they can likely qualify for. And there's no way that we're going to get to prevent this disease from going to 15 million people unless we have people come in. So we really appreciate you allowing us to speak to your audience about this, and encourage them to give us a ring at 225-763-2973 for dementia at pbrc.edu.
Dr. Keller, this came in from a listener. Two questions. Number one is, if I'm 64 and I'm already taking these medications, am I going to have to get my doctor's approval before I can be in your study? That's question one. And question two is, are you going to be able to give a definitive number in terms of Alzheimer's risk on what's too high for blood pressure and what's too high for cholesterol? So that's the two.
Boy, you've got educated viewership there. So those are great questions. The answer is to the first one is you do not need approval prior to entering the study, but once we get to seeing if you qualify, the last step in that qualification is to secure that doctor's approval. And we have a great relationship with many to most of the physicians in this community. So don't worry about getting approval before you come in or give us a ring. Also, on the second point, the answer is those recommendations as to what the cutoff should be or what puts people at the highest risk actually come about from research like this study. And so those currently aren't available. We really don't know what the recommended blood pressure should be or how it should be regulated in the elderly. We know it for people aged 18 to 40, but after the age of 40, we really don't know. And so this study is going to be really important for providing that information for physician care in the future. And we're doing this study with UT Southwestern. The chief of their cardiology is involved in this study, as well as Kansas University and WashU in St. Louis.
Dr. Jeff Keller, director of the Institute for Dementia Research and Prevention. We appreciate him being on the show.